To 8 p.m. last night, we had 112 additional cases. I want to stress the vast majority of these cases are family members or very, very close contacts.
Another day of exponential growth. The total number of locally acquired cases in Sydney since June 16 jumping to 678. The number of people hospitalised has grown by 11 to 63. 18 of them are in intensive care, 4 are on ventilators.
25 people admitted to hospital at the moment are under the age of 55 and 14 are under the age of 35.
Right now, the bulk of Sydney's cases continue to be detected in the local government areas of Fairfield, Canterbury, Bankstown and Liverpool.
We really want to stress that even if you regard yourself as an essential worker, especially in the Fairfield local government area, do not leave home if you have symptoms. Do not go to work unless you absolutely know that you don't have the virus.
Today, pharmacies and GP waiting rooms are singled out as an exposure risk.
If you're going to pick up a script or you're going to get Panadol and you've got COVID symptoms, don't do that. Get a test, stay isolated.
And there are still plenty who seem determined to ignore health guidelines.
Overnight we saw another 105 infringements written for non-compliance with the health orders, brings the total to 376 since Friday.
Today, the Premier made her clearest statement yet that how long this lockdown lasts is completely up to Sydney-siders.
In terms of the number of people that were exposed in the community whilst they were infectious, there are at least 34, and that is the number that we need to see as close to zero as possible before health will advise the government that the lockdown can end.
Well, to talk through these latest developments, we're now consulting with clinical epidemiologist Professor Angela Webster. Professor, 112 new cases today for Sydney. Some areas of Sydney are still bustling with people, it seems, from photos. Is there a valid health argument left for not just naming what is essential retail and then shutting the rest down?
I think there's been, the government has tried very hard to maintain as many freedoms as possible for people in Sydney. We're getting to the point now, though, where we're seeing such high numbers that you do have to question that. Of course, the arguments are not just health arguments. There's also social and economic considerations. Not everyone's able to shop online or able to click and collect like some of us are. And so making sure that people have access to the services they need is crucial. But I'm not sure that that extends to all of the retail shops that are open at the moment. And I would see that that is one further step that could be taken if things escalate from here.
The other detail is that 84 of the 112 cases today are from southwest Sydney. Why is it you think that the virus is concentrating there so much?
Well, of course, Sydney's a huge city and there's a gradient of social and economic advantage and disadvantage. And some of the areas that have been hit most in the last few days are areas which are more disadvantaged than others. We know that some of the communities in that part of Sydney have very strong community networks. Some of them are faith-based, some of them are cultural-based. And we know that on average, the people per household there is higher than in other areas of Sydney. So I think, in Sydney's inner west and the CBD, it's an average of about 2 people per household. But out in the parts of Sydney most affected at the moment, that's almost 3.5 people per household. And one thing about the Delta virus we do know is that it's spreading very rapidly to complete households. So if a household of 6 people and 1 or 2 people are working, one person comes home with the virus, gives it to all 6. Somebody else goes out to work, gives it to all of their co-workers, who then go home and give it to all of their family. So we're seeing numbers escalate because the households are bigger and because more people there are essential workers and who need to go out to work and have been attending work.
Professor, New South Wales Health today has made AstraZeneca available to anyone over the age of 40, but when you try and make an appointment to get that vaccination, you can wait to up to 2 months to get in. Are we really going to be able to vaccinate our way out of this latest problem?
Well, the logistics of delivering the immunisation, the vaccination programme has been huge, but that's largely been centred around the Pfizer jab, which is difficult to deliver because it requires refrigeration down to -70. AstraZeneca is not like that. It can be kept in a regular fridge. And in fact, the first directive has been for people to contact their GPs if they want to access AstraZeneca, because many GPs have stores of AstraZeneca vaccine that are still available. Booking through the online form is complicated. It's probably more complicated than some people can manage. There's a lot of clicks through, a lot of detail you need to enter. But of course, vaccine slots open up all the time. So you may go onto the system at one moment and find that the first available appointment is September. But if you go back half an hour later or the next day, you might find an appointment available very much sooner at a slightly different vaccine centre. So checking with the GPs first is important, because the GPs have been doing a great job at reaching out and trying to vaccinate their patients.
Just before we let you go, we're almost out of time, but how long do you think this lockdown, realistically, people can expect to go for?
Well, at the moment, it hasn't played out with the best case scenario. I think the best case scenario was going to be 4 to 6 weeks total. But I think from now, looking at today's numbers and expecting them to rise over the next few days, we're likely to see the effect of the more severe lockdown measures playing out towards the end of this week, where we hope things will go down. But I would think at least another 6 to 8 weeks from now before we get any kind of lockdown.
Wow. All right. On that note, we'll have to let you go. Thank you so much for your time.
Thank you. Bye.
Gosh, that's going to be hard to hear, that message, for a lot of people. I was just thinking, I wonder whether they need to bring in that test and isolate payment they brought in Victoria when the pandemic was happening last year, to encourage people to get tested, knowing they'll get some payment while they can't go to work. Because that's the big thing. It's taking people out of their jobs while they sit at home and wait for results.
The big difference here with this, I mean, and if our expert there's right, 8 weeks, you've got a whole city of 4 or 5 million people. There's no JobKeeper. So, you know, people who work in southwestern Sydney, who work all over Sydney, if they feel slightly crook, they're more than likely not to go and get tested, because they've got to go to work. They've got to pay their rent, pay their mortgage.
Has said their job's to look after businesses. It's a federal, job to look after the individual. But at this point, it's going to be...
Yeah.
Well, the Federal Treasurer, Josh Frydenberg, and the New South Wales Treasurer, Dominic Perrottet, were meeting all day yesterday. Scott Morrison was in on that call, as was Gladys Berejiklian. And they've announced nothing yet, but we're told there'll be a major announcement on a financial package to help business tomorrow. But I stress that's business. Yeah. I don't know about individuals.
So what I don't get, I don't mean to repeat myself, but like, what's really striking is all the really obvious lessons out of Victoria haven't been taken up here. And I just can't understand why you would do that. This is not that hard.
Politics is what it's called.
Well, no, but there's no politics in just not having
there's politics in the New South Wales Liberal National Party government accepting that Labor got it right in Victoria.
Right. So it becomes that those lessons don't apply to it.
Simple as that, as stupid as that might be.
It's odd. All right, we'll go to a break. More projects soon. From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed. From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.